Namaste. Welcome to Yoga with Janine. I'm Janine, and today I'm answering a question that was asked to me by one of my friends who is experiencing diastases, which is the separation of the abdominal wall that often occurs during pregnancy and continues post-pregnancy. So today we're going to be working exercises that reinforce the abdominal wall, that reinforce the deep core muscles, and that help to strengthen the reconnection of the abdominal wall into the midline, into the center. And now there are many different exercises we can do. I'm going to show you the main ones that I work with my students, whether it's my prenatal students or postnatal students, as well as my students and clients who want to strengthen their core muscles. What happens during pregnancy is that the deep core muscles get stretched out. And because they're stretched out so extremely over a short period of time, 9 months, the muscle gets weaker. And that's regardless of whether you experience diastases or not. The abdominal wall gets weaker. And so to get your abdomen back, to get your body back into shape after pregnancy, it's really important that you focus not only on the superficial muscles, the muscles that you can see under the skin, like the six-pack, but that you really go to the source, the deep core muscles that stretch out. And what I'm talking about here is mainly the transverse muscle. The transverse muscle is the tissue that wraps around the waist like a corset, and that muscle gets stretched out, and that's usually the layer of tissue that we'll often see along with other tissues protruding like a hernia that pops out of the abdominal wall if you're experiencing diastases. So it's these deep core muscles that we want to work. And one of the things that we want to make sure as you're working this, especially if you have diastases, and work more with the lengthening exercises where the spine is long and where you can really focus on drawing that corset tighter, at drawing the muscles. Even you can visualize as if you have your hands on your side and the muscles are sewing themselves back together. So let's do an exercise to begin. You bring your hands on your waistline. Take a tall seat, sitting on your knees or otherwise on a chair or on just cross-legged. Just find a comfortable seat where you can have your spine upright. So we want to make sure, especially when we're talking about yoga, we're talking about posture, and we're using the breath. So what distinguishes these exercises from maybe other exercises that you've done is that we really want to incorporate and put an emphasis on the breath. So with your hands on your waist, take a deep breath in, and then you're going to pierce your lips as if you're breathing out through a small straw. And you want the hands, you want to feel and visualize the muscles drawing in. So we do that with the hands. So you start with your hands on the outside, and then as you exhale, you bring your hands together as if you're fastening a seatbelt or tightening a corset. Inhale. And you should feel like your waist cinching in. The navel, the belly button, draws in towards the spine. One more time. So you have the waist and the belly button drawing in to the center. Okay. Now, we'll release that. Come onto all fours. And now just kind of counterintuitively, we're gonna relax the abdomen. We're gonna relax the muscles in the hips and the waist and the ribs, and you're just gonna circle your hips one way. Just breathe normally. So one of the other main muscles that we want to work with, so the transverse muscle is directly linked to the the abdomen, circle the other direction. And the other main muscle in this area is the diaphragm. So the diaphragm is part of the deep core, and we often neglect it. We focus just on the muscles that we know are part of the abs. Come back to center. So now focusing on your breath, take a deep breath in and lengthen your spine. You can arch the back here, so what I call the hanging bridge, where your spine becomes like a hanging bridge, releasing the muscles in the upper back. And then exhale and round your back. And then come back into the hanging bridge and inhale. Really loosening the muscles around the spine, and then exhale, stretching the spine. Again. And exhale. So it's really important to relax the upper back. Let's do it one more time. And then just stay in the hanging bridge here. Relax the muscles between your shoulder blades, the middle back. So the diaphragm attaches to the middle of your back. So you want to make sure that those muscles release here. Good. And then you're in this hanging bridge position, you're going to start to swing your waist to the right. So you swing the bridge like a hammock to the right, and then you swing it to the left. And you're just stretching the sides of your waist here. Now you might say, well, Janine, didn't you say that when I was pregnant, my muscles got stretched out and I'm supposed to strengthen them? Yes. However, we want to make sure that we neutralize the body before we start to actively engage and realign it. So this is in a way pressing the reset button. So you swing to one side, you create kind of a C shape with the back, and then you swing to the other side, creating a C shape with the back. And then come back to center. Inhale the sides of your body long. And then as you exhale, you're going to take your left arm out to the left. So left arm out to the left. Inhale here. And exhale, just twist it under. Inhaling, open it up. Exhale, twist it under. One more. And exhale. Good, and come back to center. Reach the right arm out. Inhale, exhale. Inhale up. Exhale, bring your shoulder down to the floor, twist. Inhale. Exhale. And inhale, come back to center. Good. Now you're going to line your belly, and we're going to do the same exercise that we did at the beginning with the breath, except our hands are not going to be there. So you're going to place your hands underneath your forehead. And just for a moment, feel your abdomen breathing against the floor, the movement of the abdomen as you breathe. Just to bring an awareness into this region. Notice how the belly expands and contracts. And then as you exhale, you're going to pierce your lips and do the exhale like a straw, like you're exhaling through a straw. And you feel the waist and the navel cinch in. Inhale, the belly expands, and then exhale through the straw. Keep going. You might even feel your pelvis start to tilt. One more time. Good. And now we're going to do the same thing lying on the back. So you're going to lie on your back with your knees bent. And you're going to again visualize your abdomen. Inhale. And as you exhale, you're going to cinch in, belly button in, and your back flattens on the floor. Inhale. The belly expands, the back arches or lifts away from the floor. And then as you exhale, creating a pelvic tilt, cinching the waist in, navel draws in. Inhale. And if you do have hernias, if you do have like a hernia caused by the diastases, then you want to make sure that that hernia is not popping out when you're exhaling. So that's a good indication that you're doing the exercise right, is that the hernia will not pop out. So it actually gets sucked back in. So you're literally flattening the stomach. And this is something I would encourage. This is something that I use personally at the gym when I'm working out or in my yoga practice. When I'm doing core work, I want to make sure that my core is engaged from the deepest levels, so that even when I do graduate to doing crunches, I'm actually engaging the core properly. Come up to sitting. So one of the things that I noticed actually when I was at the gym last time, I was watching a girl doing her abdominals, and I'm sure she was trying to get a flat stomach, but she was doing it all wrong, right? So she was coming up, and I could just see her belly just kind of popping out when she crunched. So and it wasn't because she had extra weight, it was because she was just she wasn't breathing properly. So we want to make sure that when we crunch or when we contract, that we're really contracting from the deepest point. And in order to do that, you have to do that straw, draw the navel in, cinch in the waist, so that you get that flat kind of the flat belly, and if you're experiencing diastases, you're bringing that abdominal wall closer in and really working the core so that you're not creating that hernia effect. So now we're going to put that into a little bit more work. So if you're new to this practice, you want to start with those exercises. Now, if that all makes sense to you, then you can come onto all fours, stretch your right leg back and your left arm forward with the thumb up. Now, the same principle here. Lengthen the sides of the body. Take a deep breath in, and as you exhale, cinch in and draw the navel in. Again, you want to feel the sides of your waist drawing into the navel, navel drawing into the back. One more. To advance the movement, you simply lift your back leg up, but make sure you don't drop the hip. So the hips have to stay level. Toes point down in the back. Second side. Left foot back and right hand up. Take a deep breath in, 3 breaths. Again, really visualizing a corset. So your waist is getting thinner in towards the center and your navel's drawing in towards the back. Once again, to advance, you would just lift the heel, toes point down, and the back stays full. Then you come down. Now, advancing a little bit more. Take your right foot back, over to the left. Inhale, lengthen the spine. Exhale, cinch the abdomen, tightening that corset. Press your right hand down, and you lift your left arm up. So it's a twist. You can reach it out to the side, start there, and then twist. Okay? Make sure you don't drop your back hip, right? Back hip does not drop, it stays up. Inhale and exhale. So I'm twisting deeper as I exhale. Good, come back to center. That's really tough, so go slowly. Quality versus quantity. Take your left leg back and cross it over to the right. And reach your right arm out to the side. Inhale here. And as you exhale, twist. Make sure you don't turn with your hips. Your hips stay as if you're on all fours. Inhale and exhale. Keep your arms and your legs strong. Inhale and exhale. Tighten the corset. And come back down. Good. Rest in child's pose. Relaxing your abdomen. Your abdomen needs time to relax. If you're tightening your core all day long, those muscles will get fatigued. They do need to rest. It's also good for the internal organs too. So take some time out of your day to practice this set of exercises, really tightening the core, cinching from the sides in, from the belly button back. So it's kind of moving in and back, right? So it's in and back. And make sure that you're not collapsing, okay? So there's no crunching action. You keep the length of your spine. That will work the deep core muscles, and it will help to bring some integrity back into that abdominal wall that's now separating or weak. Use your breath, use your breath, use your breath. The breath, if we look at the anatomy of the body, the diaphragm is one of the main core muscles in the body. And all the abdominal, the whole abdominal wall attaches to that, or the deep core muscles, attached to the diaphragm. So when we use our breath skillfully, we actually get deeper work, more effective work, and work that's going to last longer in the body. It's going to have longer effects in the body. So hope that helped you. Take some time to relax now, and then come back daily to this practice. Let me know how it goes. Namaste.